statewide Children's Enrollment Challenge. I'm Amy Whitcomb-Slummer, and I'm the Executive Director of Healthcare for All. And last year, Healthcare for All started the Got Coverage, Health Coverage for Kids and Teens campaign to boost the enrollment rates of children in the Commonwealth. Our Got Coverage Working Group is incredibly proud to launch this initiative today with the support of our Secretary of Health and Human Services, Dr. Judy Ann Bigby, HHS Regional Director, Christy Hager, and Senator James Eldridge, as well as 65 enrollment organizations who have pledged to redouble their efforts to enroll children across Massachusetts, and they're here with us today. For those of you who are actually representing some of the 65 organizations, can you stand as you're able and we can all acknowledge you? We very, very much appreciate it. Thank you so much for your commitment to healthy kids. We're also grateful to have children from the Josiah Quincy School here today. Is this your first visit to the State House, you guys? I forgot to ask you that. Have you been to the State House before? Well, welcome. It's very exciting to have you here. I hope you end up walking the halls for years and years. It's very exciting to have you all here as part of our statewide challenge. We're also privileged to have Jay Oberecker here, who's the health coordinator from the Josiah Quincy School, who's here and has been coaching the kids and has helped with the posters. Thank you, Jay, so much for helping us. Staff are here, and Representative Story staff is here. And thank you so much for being here. We're grateful. You know, Massachusetts truly can boast having the highest coverage rate in the country, but we still know there are thousands of children in the Commonwealth who don't yet have health care coverage, and that's truly why we're here today. We're here together to close the gap for uninsured children and help them live healthier lives in the Commonwealth. President Obama and U.S. Secretary of Health and Human Services Kathleen Sebelius have made insuring kids across the country one of their top priorities. And to support that goal, Healthcare for All and 65 organizations are redoubling our efforts to enroll children for the month of May and to truly close this coverage gap in the Commonwealth. Last fall, Healthcare for All had a successful phone-a-thon where we enrolled hundreds of children from Massachusetts. This is truly the next step in being able to provide coverage, identify children, and to reach out to other organizations where we've provided enrollment toolkits to the 65 participating organizations. And they have information in 9 different languages. So we've sent these postcards all over Massachusetts that'll help parents identify ways and the methods by which they can enroll their children in healthcare coverage. Our challenge, as we see it, is a unique opportunity to partner with these enrollment organizations and later to evaluate our efforts. So in a month, we're going to spend time identifying the successes that we've had. We'll figure out what were the challenges that kept children from being enrolled in healthcare coverage. We'll come back together and talk about the lessons that we've all learned. And then we're very excited. We'll have a report card on ourselves. And we want to deliver that information to Health and Human Services so that there'll be people all over the country who can use some of the lessons learned and repeat our successes and cover children all over the country. We're thrilled to be joined by Representative Story. Thank you so much for being here. Delighted to see you. There are many children who will be excited to meet you. We're all always excited to see you, but there are children who've never met a representative or senator or a secretary. So, I want to say a special thanks to BMC HealthNet Network Health Plan and the Neighborhood Health Plan who have generously come together and have put a fund together so that we will be making awards to the top 6 organizations who managed to enroll the most children and help us get the farthest along in succeeding in this challenge. So I have a big thanks to the sponsoring organizations and to the organizations who have agreed to partner with us. I also want to thank the staff of Healthcare for All who have worked hard to put today together and will be hanging with us for the rest of the month. Healthcare for All staff, if you'd raise your hand just so I can thank you so much. And now it is my great privilege to introduce an incredible partner for Healthcare for All and a champion for children all across Massachusetts. Dr. Judy Ann Bigby, the Secretary of Health and Human Services, has been traveling the state for months talking about the need to enroll every kid into healthcare. Our Secretary herself is a primary care physician and a health policy expert, and is a true partner in ensuring that our state delivers high quality and accessible services to all Massachusetts residents, including each and every child living in our state. It's through her passion and her commitment to this challenge that she's able to spend time with us here this morning. Without further ado, it's my pleasure to introduce the Secretary of Health and Human Services.
Thank you. So good morning, everyone. I want to thank Amy not only for that wonderful introduction, but for her leadership and Healthcare for All's leadership and this initiative. I also want to thank Senator Eldridge and Representative Story for being here this morning to stress how important this is for everybody in the state government. We're number one. Do people know that? So when you're number one, sometimes you think you can sit back on your laurels and just keep saying, we're number one. But one of the reasons we're here this morning is because Massachusetts, as a state, has accepted Secretary Sebelius's challenge to connect kids to coverage. And the reason that we've done that is because even though we're number one, with 99.8% of kids covered in Massachusetts, we know that there are over 3,000 children who don't have health insurance. And so, what difference does that make? I see the kids from the school, hold up your signs, who are telling us all 85210, which I think is a great slogan, and we should all take your advice about getting sleep, eating fruits and vegetables, staying away from our computers, in my case, and making sure that we exercise, and I don't like a drink, so I'm okay there. But while you can do all those things to make sure that you and your family are healthy, there's still a reason why we need to make sure that kids can go to the doctor. Isn't that right?
Yep.
Yes. So one of the reasons is what? Probably something you don't like very much. To make sure you get your shots. So you got it. Because we know how important it is to make sure that kids don't get illnesses that are infections that can be spread to other people in the community as a wonderful preventive step. We also know that there are other reasons why it's important for children to have a regular physician or nurse to see as a primary care provider. There are reasons that these providers can help kids and their families understand what should be happening on a normal day-to-day basis with how kids are growing and developing. There are things that your primary care provider can do to make sure you don't get cavities, and isn't that good, because then you won't have to go to the dentist and get filling and filling. So there are lots of reasons why, even when you keep yourself healthy, you need to have a regular provider. And we know that if you have health insurance, more than 97% of kids in Massachusetts report that they have a regular primary care provider. So we're very happy to participate in this challenge from our Secretary of Health and Human Services for the United States, Secretary Kathleen Sebelius. It says here that I'm supposed to recognize the partners who've signed on to this initiative in Massachusetts, and we'll get a certificate of appreciation. And there's an example of that certificate. And like Amy, I want to thank all of the organizations who signed up here. One thing we know about being successful, about making sure that people in Massachusetts get health coverage, is that we have to have partnerships. We have to have people all over the state, in communities, in schools, all over, making sure that they're educating people about the fact that there is health insurance available, and there are ways that you can sign up. Massachusetts is very fortunate that a couple of years ago we received a grant from the Robert Wood Johnson Foundation on maximizing enrollment for kids. And through that grant, we've been able to look at some of the practices that we have in our Massachusetts Mass Health Program, or CHIP, which is for the kids. And we know that there are things that we can do better as a state to make sure kids stay enrolled in healthcare. And through that grant process, we're pursuing those things to make sure that we're not unnecessarily unenrolling and putting kids back on. We know that takes a lot of time and energy, not only our resources, but it causes a lot of anguish for families as well. So there are things that we're doing at the state level to make sure that once kids get enrolled, that they stay enrolled, because we know that these gaps in coverage can create problems for people. So I want to again thank Amy for her leadership on this initiative, and we certainly are going to do everything we can do to make sure that we reach our goal of enrolling 500 new kids in May. Now I have the pleasure of introducing Christy Hager, who is the Regional Director of the U.S. Department of Health and Human Services. So she oversees all of the Health and Human Services functions for the federal government in what's called Region 1. And I know that she puts a lot of miles on her car because she's driving all around the New England states doing her role. But we're very fortunate to have her in this role. She was appointed in April 2010. Before that, she was the Chief Health Counsel to the Speaker of the Massachusetts House of Representatives, and therefore, we have a lot to thank her for because she was very instrumental in making sure that Massachusetts got the most progressive health reform legislation that any state has passed to date. She is also a professor at the Harvard School of Public Health and has a lot of talents that are serving us well in her new position. So, Christy, thank you.
Thank you. Thank you, Madam Secretary. So to be exact, in the past year, 15,400 miles driven, all over the 6 New England states, representing Secretary Kathleen Sebelius and the U.S. Department of Health and Human Services in all of the wonderful and historic work we're doing to connect so many people to coverage. And when it was $5 million in 5 years, when Secretary Kathleen Sebelius launched the Connecting Kids to Coverage initiative to identify and enroll the 5 million eligible for Medicaid or CHIP kids, but unenrolled throughout the nation. And within 5 years, to do that within 5 years. Here in Massachusetts, we know we have a long and strong history of aggressive and successful maintenance of coverage. Right now, as we know, less than 2% of the residents have no health insurance. And among those, though, a larger number of kids than we should have. And we've learned a lot of lessons during decades of health reform here. And one of them is, we can build it, but they will not come. They will not come if they don't know they're eligible, and if they don't know where and how to enroll. That's what this initiative is all about. And HHS is committed to supporting our partners in the states, which includes all of you, in achieving these goals. Every eligible child we need to find and we need to make sure has access to coverage. And we'll do that at HHS with strong internal coordination too. It's not just the agency that administers the Medicaid and CHIP programs, Centers for Medicare and Medicaid Services. It's also the Administration for Children and Families and other divisions within the U.S. Department of Health and Human Services that have a headquarters for New England right here in Boston, down the hill, in the JFK Federal Building. They're the team that we work with in partnership with all of you. And when this initiative was announced by Secretary Sebelius, she was joined by Secretary Arnie Duncan of the U.S. Department of Education. And that's because of that strong and powerful partnership that will serve all of us. We know, you just heard Secretary Bigby say, kids learn better when they're healthy, and they're happier, and they live better lives. And in the end, we are all here for you. We're doing this for you and with you all. So I'm excited to be here today. It's so wonderful to see all of you. I do spend a lot of time driving in the car, but it's because I enjoy so much being able to go out to see people where they live and work, and to find out how exactly the U.S. Department of Health and Human Services can work with you to make sure that we serve you as best we can. Secretary Bigby also mentioned my experience here in this building before I went to the U.S. Department of Health and Human Services, working on health reform here and expansion of access to coverage for almost everyone. And we know our work is not done. And while I was doing that work, I was very privileged to be able to work alongside members of the legislature like Representative Story and Senator Eldridge, who at the time was a member of the House of Representatives, now serves Middlesex and Worcester districts in the Senate, in the state Senate. You're going to be able to hear about his role, but I assure you, in my experience firsthand, he has been a very powerful advocate and close friend to all of you and to serving your interests. And I am privileged to be able to introduce him. So, to you, Secretary.
Good morning, everybody. And first, I just want to say to the students from the Quincy Elementary School, welcome to the State House. And you are really the best ambassadors for this kickoff today to get families across the state to enroll in Mass Health. So I really want to thank you for being here and for all of your efforts, because it's really going to make the biggest difference in reaching out to families across the state to make sure that all kids across Massachusetts have Mass Health coverage. I also want to thank all the community providers and community organizations for being here, and I'm extremely honored to be amongst this group of speakers. Christy Hager, who Representative Story and I worked with very closely on passing the Massachusetts healthcare law in 2006 that got Massachusetts to this point, and I'm very honored to work with Healthcare for All, which worked on not only implementing and helping pass that law, but now moving forward, and then of course Secretary Bigby in terms of our next steps forward for where Massachusetts is going to go to expand healthcare coverage and deal with healthcare costs. I just want to say that it's a real honor to stand here to be as the lead sponsor of Senate 10, which is a bill that I sponsored with Representative Story, who is also an incredible and passionate supporter of universal health care, to file legislation that would provide 12-month continuous coverage for families across Massachusetts who are receiving Mass Health. We know that as much as Massachusetts has made some great advancements in health care, that there are a number of gaps, and I believe very strongly that no child in Massachusetts should be falling through the cracks and not have health care coverage. I know this morning, reading the Globe, there was a very powerful story about a woman from Boston, her story about her daughter who had different instances, I think 3 over the past year, who did not have health care coverage when her daughter needed help. That's the sort of thing that we're hoping will stop with this kickoff challenge that begins today. So I want to thank everyone for being here. It's really exciting to be among so many healthcare providers and healthcare reform advocates. And I have the pleasure of introducing someone who's actually going to help all the kids here implement the work and has already been doing a great amount of work. Teacher at the Quincy Elementary School, Jay Oberacker. Jay?
Thanks for having us. We're very excited to be here from the Josiah Quincy School. I want to introduce Regina Audi, who is our social worker at Josiah Quincy. I'm going to talk a little bit about the services that we provide at the Quincy School. We really use a lot of the partners in our community, so it's great to see all of you out here supporting Healthcare for All. Just quickly though, I want to say that we walked here. There's an MBTA station outside of our school, but we made sure to walk here. And we also walked right by the elevators and took the stairs up as well. So that was a choice that we made together. At the Quincy School, we provide dental screenings for all and cleanings for free. We have a healthcare facility right in our school. We have a partner called Playworks that structures recess, so the kids have choices at recess time, fitness choices that go along with our curriculum. We have a research-based curriculum that covers nutrition, fitness, substance abuse awareness, as well as mental health and social skills, which we think is really important. As far as mental health goes, we have so many great partners working with City Connects, which pulls together services for kids that are underprivileged, as well as kids that are really advanced academically. We try to look at the whole child and make sure that they all have services. So we're very excited to be here to support all these students that we need in the state to be covered. Up to 500 is our goal, right?
Yes.
So thank you very much for allowing us to be here. Tingwei, do you want to come up and show your poster quickly? This is sort of the theme of our health program. This is a day in the life of a Josiah Quincy student. We want to practice 8-5-2-1-0. What does 8 stand for?
8 stands for 8 hours of sleep.
5,
5 stands for 5 servings of fruits and vegetables.
2,
2 hours of food.
or?
Or 1 hour to eat.
Okay, or what does screen time include as well?
Computers.
Wii, Xbox, PlayStation, everything, right? 1 hour of what?
Exercise or food.
That's right. And 0,
It stands for
0 sugar added drinks. So that's the message that we bring.
Thank you, Amy. It's wonderful to see a room full of healthy children. You all look so good. It is in all of our interests to have healthy children. It's not only the compassionate and humane, there's not only compassionate and humane reasons to do so, it's in our financial interest. Early intervention saves money as well as heartache. To have a system where children are denied health coverage because of bureaucratic rigidity defies life. Legislators are asked to do some things that are hard. We're asked to do some things that are impossible. But this is not one of them. These are regulations and rules that are within our control. This doesn't even cost money. This bill that Senator Eldridge talked about is absolute common sense. And I am hoping that this year will finally be the year that it has passed. And I am grateful to all of you for showing up today to help in this effort. Thank you.
delighted to have you here as well. So thank you. So now, I know you guys are getting restless, even though you're so healthy and fabulous with 85210. And now you're going to help me because we're going to talk about how many kids we're going to cover in a month. So, how many altogether? 500. How many altogether? 500. Can we count to 500? They think we're going to do it by ones. We're doing it by hundreds. Ready? How many? 100, 200, 300, 400, 500 kids. That's fabulous. Thank you so much. So, in a month, we're going to make sure that 500 children across the Commonwealth are connected to good health care coverage through the efforts of these 65 partner organizations and with leadership from Healthcare for All. We'll meet again in a month. I'm very excited that there'll be other children who will be able to talk about 85210 and you guys will be able to share what some of the challenges of actually turning off the television, getting an hour of exercise. I heard from some runners, that was very exciting, and thinking about what your very favorite fruits and vegetables are so that you'll stay healthy longer. And even though you'll have access to a primary care provider or a doctor, you'll spend less time probably in the doctor's office and certainly less time in the hospital because you'll be so fabulously healthy. That is exciting, and as Rep. Story said, it saves money for the Commonwealth. It also saves more playtime for you guys. So, I just want to say thank you so much, and in a month, we will reconvene and talk about an award, recognize the top 6 organizations who've managed to enroll the most children and have helped us with our lessons learned so that we can pass those lessons on to the rest of the country. It is my pleasure to again thank very much Representative Story, Christy Hager, Secretary Judy M. Bigby, and Jay, I'm so sorry I've lost your last name.
Over.
I beg your pardon. Thank you so much. These kids are thrilled that you're here. We also have a member of Healthcare for All's Board of Directors here. Jackie Coogan is one of our partners who will be signing up children this month. So thank you very much for being here and for your leadership. All right, special thanks to the gut coverage, health coverage for kids and teens campaign members. Raise your hand if you're a member of that campaign. Good job, well done you guys. Thank you very much. And let's go find these children and get us, I beg your pardon, as well.
They're here as well.
The sponsors, thank you very much. BMC HealthNet, Neighborhood